So patients entered that study in first complete remission. We did not allow patients to enroll who had been relapsed and salvaged. Everything had to be going perfectly with the patient, and they had to proceed through an allogeneic transplant, complete it, be fully engrafted. So in other words, again, everything has to go perfectly, and only then we can enroll them and ask the question, at this point, do they benefit from a FLT3 inhibitor? And so they were randomized to placebo or a FLT3 inhibitor that they would not be able to distinguish from placebo. Unlike the drug that's used widely in the world, sorafenib, no one believes that that is going to be useful in a placebo trial. It causes immediate and unpleasant side effects that's going to be obvious to both the clinician and the patient. Gilteritinib, which is a second-generation FLT3 inhibitor, causes virtually no side effects that the patient will be able to report. But it does cause significant effects that the clinician will see, such as potentially a drop in blood counts, increased liver enzymes, exacerbation of GVHD, things that might take time to develop. So the patient is unaware that these things are going on. So in that study, we enrolled 356 patients worldwide, something like almost 20 countries. We did not stipulate the type of transplant. You could get any conditioning regimen, any donor, any GVHD prophylaxis, whatever they want. And under that circumstance, it was not of benefit to everyone. The prior studies to compare it to very carefully restricted the type of patients going on. So to broadly state from those studies, everybody should have a FLT3 inhibitor is frankly wrong. However, with our study, we did build in very specific time points of ascertaining MRD. And that's really what revealed who needs the drug and who doesn't. So we've actually learned quite a lot from the study. Some looking at it would just dismiss it as a negative study, but in fact, it did exactly what we wanted it to. We identified the patients who benefit from FLT3 inhibition after transplant.